Okay, so we're talking with Lindy about pre-exercise questionnaire before we start, and look at what Lindy wants to achieve out of her program, and we'll have a look at going out and getting on the gym floor and getting busy. So welcome, Lindy.
Thank you.
Just like to run through our pre-exercise questionnaire. Also on the back we've actually got a risk, release and indemnity, which basically you've had a read through this before.
Yep.
You've come, so I just would like to make sure that you're fully aware of the risks associated with training. Basically a lot of that says we take every care that we can in a gym sense and in a training sense, but ultimately responsibility comes down to you to let us know whether an exercise is appropriate for you or not.
Yep,
Okay?
sure, I've read that.
Okay, so just getting started. Do you have or have you ever had heart disease, cardiovascular, including heart attack, heart surgery, pacemaker, heart failure, valve disease, heart transplant or congenital heart disease?
No.
Have you been hospitalised recently or had any surgery in the last 5 years?
No.
Are you pregnant or trying to conceive, or have you had a baby in the last 3 months?
No.
Do you have high blood pressure above 140 on 90?
No.
Have you got raised cholesterol or triglyceride levels?
No.
Any history of gout, stroke, diabetes, epilepsy, glandular fever, rheumatic fever or a hernia?
No.
Stomach or duodenal ulcer?
No.
Do you smoke?
No.
Any pain or major injuries to the neck, back, knees, ankles or shoulders?
No.
Have you ever had any of the following? Are you a male over 45, female over 55 and not used to regular exercise?
No.
Dizziness, fainting or blackouts?
No.
Family history of heart disease?
No.
Palpitation or pains in the chest?
No.
Unreasonable breathlessness?
No.
Arthritis, asthma, cramps, muscular pain?
No.
Liver or kidney condition?
No.
Are you dieting or fasting?
No.
Are there any other conditions or medications that would require you to modify your exercise program?
No.
Okay, just so we know, and it's just more or less in case of emergencies, if we need to speak to a doctor, specialist, physiotherapist, is there a name of a practitioner we can put down here?
Yep. Yep. Dr. Kate McInerney.
How do you spell McInerney?
McIennery.
Yep.
N-E-R-Y.
N-E-R-Y.
Yep.
And Dr. Kate, what is the practice?
Will Street Medical Centre.
Wall Street Medical Centre. Okay, so we can look that number up if we need.
Yep.
And that's in Pittsburgh?
Yep, that's in Pittsburgh.
Okay, just as discussed before, we like people to come in and acknowledge the risks associated with training. So this is just a warning that this is a legal document and it affects your rights and obligations. Please read it carefully. Do not sign it unless you understand it, and have any questions, please ask. So you have been through that just because we're time pressured here today. You understand the risks associated.
Yep.
Okay, so I'm just going to sign that here as a trainer and date it. And if you'd be so kind to sign that.
Sure.
Thank you, Lindy. Now we'll file that for our records. Obviously everything is confidential that's been signed, so your confidentiality is protected, and we'll go out and let's start your exercise.
Okay, thank you.
Righto, let's go. That's all.